This is PT Pro Talk, the podcast for physical therapists who want to improve their clinical skills and be more successful. I'm Mariana Parks, physical therapist and your host, and today I'm joined by Dr. Jóna Ólafsdóttir to discuss assessing neck function with the NeckCare system. In this episode, we cover how NeckCare is revolutionizing neck assessment through real-time data and sensor technology, measuring range of motion, joint position error, and sensory motor control, how clinicians can apply NeckCare's insights in treatment, including athlete care and broader research initiatives, challenges clinicians face with new technology, and how tools like NeckCare can support better patient engagement and confidence, and much more. Dr. Jóna holds a Ph.D. in biomechanical engineering and serves as the Chief Research Officer at NeckCare. She leads cutting-edge research on human movement and neck function. Through collaborations with top institutions like Harvard, her work is helping to redefine how we assess and treat neck-related conditions. NeckCare, the company she helps lead, is at the forefront of developing evidence-based tools to support clinicians and improve outcomes in neck health. If you find our conversation informative, don't forget to subscribe, hit the notification bell for updates, give us a thumbs up, and share this episode with colleagues who could benefit from these insights. Thank you for tuning in, and now let's dive into the discussion. PT Pro Talk is only possible with the support of the forward-looking and innovative companies like NeckCare.
Treating neck impairment? Get objective neck assessments with the NeckCare system. Learn more at neckcare.com.
Hi, Jóna. Welcome to PT Pro Talk. How are you today?
I'm doing fine. How are you, Mariana?
I'm good. Thank you. So let's get started just talking a little bit about yourself and your background.
Yeah, sure. My background is in engineering. I'm an engineer. My undergraduate and graduate degrees are in mechanical engineering and mechatronics. And then I have a Ph.D. degree in biomechanics. So prior to joining NeckCare, I was a researcher at Chalmers University in Gothenburg, Sweden. And there I was a part of an injury prevention group at the Division of Vehicle Safety. So there we were looking at various systems and applications that are designed to prevent and mitigate injuries in motor vehicle accidents. And so a part of that was developing methods to predict injuries. So the research that I was involved in the past was mostly on kind of human responses in pre-crash situations. So meaning when you're in an emergency scenario, when you're driving your car and you need to emergency brake or emergency steer away, and you tense up your muscles. And so I was developing methods to model that response and doing experiments with human subjects to measure the response in simulated events. And sort of along the way, my focus morphed into looking specifically at the neck and sort of the head-neck response in these scenarios. And, the neck is a very interesting structure when we think about it mechanically and sort of the dynamics of the head-neck complex. And so, modeling the movement and responses of the head and neck, it's a very interesting engineering problem. So that was very exciting work. And this area of research, it deals, mostly with injury prediction, prevention of injuries, mitigation of injuries, and rarely looks at what happens after the injury occurs. And so eventually my interest sort of evolved into, I wanted to know more about how we evaluate the extent of these injuries that occur in car crashes and motor vehicle accidents. And sort of what are some of the long-term effects. And I wanted to explore more the clinical side of things. And sort of that is what ultimately led me to NeckCare. And so I've been working at NeckCare for the past 5 years now, and there I am a chief research officer. So I lead a team of clinicians and engineers. So it's a great mix of brilliant minds there. So team research at NeckCare, we are, involved with kind of providing clinical and scientific expertise into product development. So we, work with developers and product management on refining and defining clinical requirements. What are clinicians looking for in tech like ours? What kind of features do they like, and what are some of the scientific requirements on outcome measures and so on. And we do product validation. So that's a very cool part of the job where we get to do a lot of measurements in the lab, both in terms of validating the measurements, the sensor, and so on, as well as clinical validation. So more kind of reliability of the system, that sort of thing. And so we also manage all our internal research projects and research partnerships. We work with academic institutions on research projects, and we develop all the internal educational material.
Before we continue our conversation, I wanted to take a quick moment to tell you about a special offer from Sarah Health. Visit sarahealth.com/ptprotalk for a 90-day free trial. That's sarahealth.com/ptprotalk. Make RTM simple. Choose Sarah Health. That's sarahealth.com/ptprotalk. And now let's get back to our conversation. That's cool. That's a lot of things. I was just thinking when you start talking about an engineer background, how, like, if you ever thought about how your role would evolve and now you are involved on healthcare, that's very different than like your initial, background. So that's interesting how things evolve and your interesting changes. And now you are involved in healthcare and neck. So that's interesting.
Yeah. So it's a great way to combine that interest in engineering, mechanics, and then just biology and in human physiology.
Yeah, no, absolutely. And be able to mix that with the clinical applications and, develop something good that clinicians can use, and it's, practical, and it's not just, this theoretical research. So it's cool.
Yes. Yeah, definitely. And, we in this space, we definitely need that collaboration happening. Engineers are really good at developing good tech and, good software and sensors and so on. But of course, it always has to be designed in the from the perspective of the use case, which is the clinician and the patient. So we definitely need that input, and we are lucky enough to have clinicians working here at NeckCare where we can kind of combine these expertise.
And since you're talking about the sensors and everything, so could you just give us an overview of the NeckCare system? So how does it work? What do you assess and all of that?
Absolutely. So the NeckCare system, it's a medical device. So it's listed and registered with the FDA. And it's a wearable sensor that connects to our software via Bluetooth, and it streams head movement data while a patient performs various neck movements that are guided by the software and by the clinician. So the sensor is worn on the head, and it measures the head movement. And the system is intended to evaluate functional performance of the cervical spine. And so we have several movement-based tests that are used to assess musculoskeletal and neuromuscular health of the neck. And so we have various clinical outcome measures that have been validated in the literature. And these are 3 assessments that are range of motion, so active range of motion. And the second is joint position error test, which is intended to evaluate proprioception, and more specifically, joint position sense. And then we have the butterfly test, which is our proprietary test developed here internally, and it is used to evaluate sensory motor control.
Okay. Just a quick pause to share something exciting. I've been working behind the scenes on a tool to make prescribing home exercises easier and faster for PTs. It's built based on feedback from therapists who have told me they are tired of clunky search tools, limited customization, and complicated sharing. I will be sharing more soon, but if you're curious and want early updates, you can join the interest list using the link in the show notes. All right, let's get back to the conversation. So, for example, on the active range of motion, right? The first thing that you mentioned. So, when you are wearing the sensor and you have the software, so are you following prompts on like what the system is doing, or you're just doing like what you want? So, how does it work that?
Yeah, so we have a standardized protocol on how to perform the test, and the software prompts instructions to the clinician to guide the patient through the movements. And then you're getting visual feedback at the same time, either to the clinician or to the patient, depending on which assessment you're doing. And the sensor automatically detects, for instance, in the range of motion test, it automatically detects your maximum range in the respective movement that you're currently performing. So you're going through the movement, and the sensor is capturing the movement and streaming the data in real time. And then once you've completed the movements, the software analyzes the data and produces automatically the reports with the results. So you can either look at kind of graphical representation of the results. So we've kind of these nice pictures of the different metrics, as well as the numerical results. So you can kind of dig into the data, but you might not necessarily show that to your patient, all the various numbers, but the graphics are very nice to use in communicating with the patient, because they kind of grasp their result and their performance quite immediately when looking at the graphs.
And it's what I think is cool that's so objective and they can visualize it. So I assume it's cool for the patient to see that in real time how they're doing, and it's an objective measure. So it's really cool that you are producing that data.
Yes, absolutely. And, talking about sort of the perspective of the patient, we we hear that from our customers and researchers that have used the product with patients, is that patients really, really like the system. It's for them, it's getting a number, getting a visual on their performance. It makes it so clear to them that, when there is a deficit, they see it immediately on the graphs. They're getting their results compared to normative data. So you kind of see immediately, oh, I'm in the red, or I'm in the yellow, or I'm in the green. And so we hear that again and again, that patients really appreciate, getting their evaluation with NeckCare.
Mm-hmm. That's very cool. And the second thing that you mentioned, the joint position error, right? To test proprioception. So how does that work? Like you have a series of tests. Do you want to just talk a little bit about that?
Yeah, definitely. So the joint position error test is how it's typically performed in the clinic is that a patient is sitting in front of a target and they have their eyes closed. So this is intentional to remove sort of visual cues. And the goal is to do a head movement to the max range and then come back and find the original starting neutral position just based on feedback from proprioception. So you're not getting any visual input, but you are attempting to find your neutral. And so this is typically done in left-right rotation and flexion extension. And when there is a proprioceptive deficit, patients, they come back, they have their eyes closed, and they're like way off the target. They're at the edges or way off the target. So that is an indication that there is a deficit or an impairment. So we have implemented this test, and it's heavily researched. There's a lot of studies out there utilizing the joint position error test, and so we have made that digital, and no input needed from the clinician in marking, where the patient is perceiving their neutral. So it's all automatic, and then analyzes the data and spits it out.
That's so practical, right?
Yeah, yeah,
Good for the clinician.
indeed.
And now just jumping to the practical application. So what kind of patients do you see that happening the most, having those deficits?
Yeah, that's typically, patients with neck pain or neck pain related disorders. So kind of idiopathic neck pain, whiplash associated disorders, and then, any cervicogenic dysfunction. If that's cervicogenic dizziness or cervicogenic headaches, for instance, this would be the typical patient population that is being assessed with the NeckCare system. And so anyone that has had trauma or injury to the neck, so that, often happens in typically motor vehicle accidents or personal injury cases, and also concussion, because when an individual sustains a concussion, it's very likely that there is some injury happening to the neck simultaneously. And so a lot of our users are seeing patients that have had a concussion, either a sports related or from a motor vehicle accident.
Mm-hmm. I was just asking you, I was curious. I know you're not a clinician, but if that it would be something prevalent with the population that just has neck pain, right? They didn't have like concussion or trauma or anything. Do you find that being like prevalent in that type of population, just like with neck pain?
Mm-hmm. Yeah, sure. And I mean, for instance, the butterfly test, which is the sensory motor control test, it has been studied on that particular population with idiopathic neck pain. And we see with the butterfly test that it's able to differentiate at least idiopathic neck pain from healthy subjects. And so it appears so that in this population, it's common that there is a component that is resulting in deficit in that system. And so that's definitely relevant. And same goes for joint position error. And, of course, range of motion, this is typically what you would always evaluate with that population. And yeah, so definitely relevant.
Okay. And now, would you tell us about the butterfly test?
Yeah, for sure. So the butterfly test, which used to be called the fly test in the past for some of the listeners that have seen the research. But this is essentially what kind of started NeckCare. And so the founder of NeckCare, Dr. Christensen, he was a practicing physical therapist, and he did his dissertation around people with neck pain and whiplash associated disorders. And he found that also in his practice that he was there was a gap, and there was no good way for him to evaluate this component of sensory motor control. And so he went out and developed the butterfly test. And so in the butterfly test, to kind of explain how it works, what it looks like. So the patient is wearing the sensor on the head, and the software displays a dot that is moving on the screen. And there's also a cross displayed where with head movements, you are controlling the movement of the cross. And so the objective in the test is for the patient to track the dot as accurately as possible. And the dot is moving unpredictably. You can't see the path that it's following. And so it's moving unpredictably at various velocities. And your goal is to stay on top of the dot, to follow the dot. And so it's a tracking task, and it's really kind of relying on movement sense and good performance in movement sense, and combining with the visual input as well.
Mm-hmm. That's so practical too to the clinicians, right? I was just thinking that you just have that data, you have that test ready there, you just have the patient doing it. So
Yeah, yeah, exactly. And it's there's really no other way to do it, this type of evaluation, without having some kind of motion capture and real-time feedback of your movement. And so it's
it's
a
difficult.
yeah, yeah, yeah,
Yeah. And then based on these three tests, right? The range of motion, the joint position error, and the butterfly test, the application is for all those cases that you mentioned before, right? The neck pain, concussion, whiplash, right? That's the main population that benefits the most from the system,
yeah,
correct?
exactly. Yeah, that's correct.
Okay. And then now the clinicians, thinking about the clinicians, so how they can use that data. They're gonna do on the assessment, and then that's gonna help guide their treatment. So how, in practical terms, they use that data?
Yeah, yeah. So when they look at the results in the NeckCare system, they will have the patient's performance compared to normative data. And so you will see immediately how much the patient is different, how much the patient is different from healthy performance. And so that gives an indication that there might be an impairment or some sort of deficit in that particular function. And so when you have identified that deficit in these particular functions, you can immediately start applying, the results as a guide for targeted treatment. So you're seeing a deficit in that function, you start training that function. And so if you see a deficit on the joint position error test, you propose to the patient to do joint position error training. Same for the butterfly. If you are seeing a deficit on the butterfly test, you can generate an exercise program or training regimen that trains that particular function. And so guided treatment, and also then to monitor progress, right? So it's a really good way to see, is what I'm having my patient do in the rehabilitation, is it working? Is is he getting better? Not only subjectively, but also objectively. And so you can do reassessments along the way, compare to the initial assessment how the patient is progressing. And then, like we talked about earlier, the patient communication. I think this is an aspect of the utility of the data that shouldn't be underestimated. Having personalized reports that to show to your patients, this is how you did on these assessments, these are your results. There is a deficit here or there, I think is very powerful. And so it's both kind of the communication with the patient and also communication with other providers. And it helps, we've heard this from our users, that it really helps with treatment buy-in. So kind of both with other providers, and then also, of course, the patient. They're seeing immediately there is a problem here. We need to address it in order for you to improve and get better, and and that's really helpful in that process. And and just kind of revealing to the patient, and for the patient to get validation of their their state, because especially with whiplash, for instance, whiplash type injuries, often patients they haven't been properly evaluated for the particular deficits that appear or with their problems. So like with whiplash-associated disorders, there's usually no visible structural damage or injury. And, I'm just thinking about this case that one of our users presented at our conference a couple of weeks ago here in Iceland. Carly Matson, she's a physical therapist at Twin Cities Orthopedics in Minnesota. A really phenomenal physical therapist with a background in vestibular and orthopedic physical therapy. And she kind of presented a case study where she applied the NeckCare system with a patient that came into her clinic. She was a 45-year-old female who had had a motor vehicle accident 9 months ago. And she had received at the time 4 months of physical therapy, but now 9 months later, she was in severe pain still. So like 7 out of 10 on the visual analog scale. So quite a lot of pain. She was having daily headaches as well. So still having a lot of problems post her accident. And, she said that after looking at her findings, the reports from the NeckCare system, she got very emotional, and she actually cried because it was so revealing to her. She could immediately see that her results were kind of all over the place. This poor lady, she very clearly had impairment in her sensory motor and proprioception system. And she had told her physical therapist, Carly Matson, there that, she had come to a place where she was wondering if it was just in her head. Her friends and family and she felt that they were starting to think the same thing. And getting her results so visual and presentable, it validated her experience. So that was a very kind of impactful way this data can be useful for patients.
Yeah, because sometimes it's just hard to diagnose these impairments, right? Range of motion, everybody does it. But the other ones, it's harder to assess. So it's just helping diagnose. And I think once people see that, the patients, they are motivated to hit the target, improve that. So they have that data, they have something to work towards. It's not just, the range of motion and mobility. So that gives you that ability to have something concrete to show them so they can, I feel probably get more motivated to walk towards that objective data that you are presenting.
Absolutely.
So that's really good.
That's exactly right. And we've even heard from some users that patients are kind of requesting it. So they kind of come into the clinic, they've done their initial evaluation, they've been doing treatment, and they've done some reassessments with the NeckCare system, and then they come in, this week and they're asking their provider, so are we not going to do NeckCare today? Or because they want to know, are my numbers improving, or how am I doing on my numbers?
Yeah, they have something to look forward.
Yeah.
And then you use the system just on assessment, or can you use as a rehab tool?
So right now it's only assessment, but it's a great question because we are currently developing a rehabilitation module. So we will be launching that very soon, and the goal is to have exercises that match each of the assessments. So you can do mobility exercises, joint positioner exercises, and butterfly type exercises.
Yeah, because I was just thinking it would be easier to use, for example, the butterfly, you're going to practice that sensory motor, but if you have something in front of you that you can practice, probably be easier, more objective. Same thing with the joint position error.
Yeah,
so
exactly.
Interesting.
Yeah, and the only way the NeckCare system is the only way you can really train this particular type of sensory motor exercises. So that's a benefit, and it helps with engagement in training as well. That you're kind of you have this device and you have something in front of you, kind of almost like a task that you're doing.
Keeps you engaged.
Yeah.
Yeah. Good. And then you mentioned you also treat concussion, right? In one of your populations.
Yeah, for sure. So a lot of our users are specialized in concussion management, and and they've really found usefulness in doing neck assessments. And so the with concussion, like I said earlier, it's very common that there is that that the neck is affected, that is a concurrent neck injury happening when you get a head impact. And studies show that, and it varies a little bit between studies, the frequency, but something somewhere between 30 and 60% report neck pain after a concussion. So it's a very common problem. And when you start looking at people with persistent post-concussion symptoms, then the frequency really goes up. It's even higher for that population. There is some neck component there, either neck pain or cervicogenic problems like dizziness or headache.
Mm-hmm.
And yeah, and also some of the research has shown that concussion patients with neck pain, they take longer to recover. So it's very important to address, the neck and problems with the neck when managing concussion patients.
Mm-hmm. I was thinking about athletes. So have like you have concussion on like American football and other
Mhm.
esports.
Yeah.
Have they used NeckCare? Is there any type of sports teams or things
Mhm.
like that that been
Yeah.
using NeckCare?
Yes. We recently partnered um, with UFC, the UFC Performance Institute. So we are working there with Dr. Heather Linden. She's Senior Director of Sports Medicine at UFC PI. And so they are using NeckCare now in their kind of fit to fight concussion protocols. And so they're both doing baseline assessments of all their athletes, and then they're integrating NeckCare into. They have this very nice, highly advanced concussion protocol. So management of concussion when the fighters there. Concussions are very common in
I
UFC.
imagine. I can watch them.
Yeah. Yeah. And so, like Heather said, they were really missing that one component of assessing sensory motor in the neck. So they have now integrated neck care into their overall protocol. And we're also working with football teams. So we recently started working with Nebraska football. So they are doing baseline assessments of all their football players now that the season is about to start. So that's very exciting. And we're also working with Dr. John Letty out of University at Buffalo. He's a sports medicine doctor and looks at concussion quite a lot and does a lot of research around concussion. And so he's has a couple of research studies where he's using neck care as an outcome measure for both collegiate athletes and also military population.
That would be very interesting to see all that data from all these athletes. I would be curious to see how their neck behaves after all of that.
Absolutely, me too. And it's an interesting population to study because not only they're exposed to a lot of injuries, but it's also they're highly trained, so they have maybe a different baseline than sort of the rest of us. So we are looking at how that differs for that particular group of individuals.
That would be very interesting. And like, are you planning on doing research with that? Or like, what kind of research are you involved?
Yeah, so in these studies I just mentioned, for instance, with the military, it's a DoD funded study. They are, they're doing a randomized controlled trial looking at different interventions with military populations that sustain a concussion. And NeckCare is the primary neck function outcome measure that they're looking at, before and after the treatment. So they're comparing different treatment arms and using NeckCare to gauge how the patients are progressing and if there's a significant difference between the different groups that are receiving the different interventions. So that's one example of where NeckCare is being used in concussion research.
Mm-hmm. Okay. Are you involved in other type of researches? Because I would think like with the sensor and all this data, it's so good to generate all kinds of research, right?
Yeah, no, for sure. We are working with quite a few universities that are applying NeckCare as an outcome measure in various types of studies. We have one professor in Germany who is doing studies on jaw pain, neck pain, kind of patients that have jaw pain and neck pain together. We are also working with Harvard Medical School on older adults. So that's a very interesting project where we are studying older adults with neck pain and sort of the association between their performance on the NeckCare assessments and balance and gait. And so there are some studies out there that have shown that individuals with neck pain, they have poor postural control. And so if there's an association between balance and neck pain, this can be a big implications for older adults that are at risk of falls, for instance. And so we're exploring this to kind of gain an insight if we can see a relationship between your sensory motor control performance, the cervical sensory motor control, and balance and gait.
Mm-hmm. Yeah, very interesting. And thinking about clinicians, because probably researchers are very excited about using that. You have data, is really good to, very objective. And then we know we already discussed that patients will probably be more motivated. It's an easier tool for PTs to use for assessment. But what do you think are the main barriers? Do you think clinicians struggle with using technology or implementing that, maybe because of the time constraints of seeing patients in a busy clinic? So what do you feel are some barriers that prevent clinicians from using the technology?
Yeah, that's a very interesting question because we hear that a lot when we talk with clinicians. It's like, I have no time
It sounds wonderful, but how I'm gonna do it?
Yeah, exactly. And I totally get that. Clinics are so busy all the time, and there's very little time left over to adopt new technology. And we actually did a study on this with the University of Miami. That's Dr. Marlon Wong, who's a physical therapist at the University of Miami. We did an implementation trial with him, and so they were kind of studying perspectives of stakeholders, so both clinicians and patients, when adopting the NeckCare system. And some of the barriers that they mentioned was, well, they did say time, but also kind of missing that understanding of the underlying mechanisms for deficits that the NeckCare system reveals, and kind of the lack of existing, specific treatment targets in response to the NeckCare outcomes. And so we've been working quite a lot internally on this particular barrier that, like I said, it's when you don't have time to implement new technology, you certainly don't have time to educate yourself on the science behind it and sort of how to build the clinical reasoning based on what you're getting out of it. And so we are developing educational material around, our product and the data that is being captured, so that, our users we can compile that in one place for our users to start immediately learning the background that they need to optimally use the system. So, it's things that you have learned in the past, but you might need to kind of refresh a little bit, and you don't have the time to go and find the best resources on where to sort of review the literature and so on. So we're trying to compile that together. And so we're working on kind of courses and lectures around that material.
Yeah, no, that's good, because I was thinking maybe clinics that focus more like on neck rehab or whiplash, they are more like specialized. It makes total sense. But maybe the general, like, orthopedic outpatient setting, they do that very basic traditional physical therapy that, is range of motion, is strengthening, and they don't focus much on that other type of environments. So definitely, like, then they get the results and like, okay, so now I'm gonna work on this, right? So
Yeah,
it's a
yeah,
good it's a good
exactly.
guide for them.
Yes,
So
exactly. So guiding them on how to use the assessments and then how to use the data and apply the appropriate exercises and training for rehabilitation. So we want to kind of bridge that gap as well.
and do you see a lot of like outpatient settings using the system, or is it more like clinics that are specialized, or maybe athletes like we said that really need to focus on that for concussion or for other reasons. So how do you see that happening? Who uses?
It's both, I would say, maybe more so on these kind of specialized clinics that are focused on either concussion rehabilitation or sort of motor vehicle accidents and personal injury. So a lot of uptake there. And as well as athletic teams, like you said, yes. But outpatient too. And we're also we have customers that are kind of healthcare system type clinics. So it varies.
Okay. And I know you mentioned that case on the conference. I know you had your conference
Yeah,
a few weeks ago. So how was it? And I know you have your advisory, your clinical advisory board. They were our previous guests. So we were talking about that, Chad and Juliet, right? So how was the conference?
it was fantastic. It was everything I could have hoped for. It was the first time we did this, and it's kind of our mission at NeckCare is to advance neck rehabilitation through technology and education. So, kind of hosting the conference was a part of that education mission that we have, and the goal was to just bring together experts in different fields of healthcare that are interested in the neck and neck rehabilitation, to sort of look at what is the latest research, what is the latest, what are the latest trends in clinical practice, and to kind of just exchange ideas on these topics. So it was really great. We had, like you mentioned, Julia Treleaven and Chad Cook speaking there, and it was just a really good mix of physical therapists, chiropractors, MDs, both in presenting and attending. And yeah, it was just really great fun.
Good. And Julia was here on episode 97, I believe. So we discussed a lot of these neck impairments. If our listeners want to go back and check that episode, it was a really good one to connect with this episode. We had Chad Cook, but also talk about research. So not about neck specifically, but the Julia interview was really good. So if people want to go back and check that, so they can connect the dots with
Absolutely.
with our episode.
I've seen it, and I highly recommend listening to that episode. It truly goes into the specifics of this topic, and Julia, she's really the world expert on this topic, and she's great at explaining the clinical side of these things, and we are very lucky and honored to have her on our clinical advisory board. She's a fantastic person. Yeah.
And talking about education, do you have any recommendations for people to go to if they want to learn more about the topic?
Mm-hmm. Yeah. Well, certainly, all of Julia's work, essentially, she has written so many papers on this topic that are just really great and useful, I think, for everyone that wants to learn more. Also, studies that from Gwendolyn Joel. She is also in Australia, like Julia, University of Queensland. And I believe she's been on your
She's
show as
been
well.
here. Yes.
Yeah. So listen to that.
I don't remember which episode, but she's been here.
Yeah. So look for that, definitely. Also, the work of Deborah Falla at University of Birmingham. I could highly recommend. And all of these ladies just mentioned, they have also written a book on this topic. So they have co-authored with also Sean O'Leary a book called Management of Neck Pain Disorders. And the title says it all. It's the one best resource on this particular topic that is out there, really. And so I cannot recommend this book enough. It covers all the necessary information from clinical and scientific background of neck pain and neck pain related disorders, how to assess these patients, and what sort of treatment to apply. And it gives a lot of good recommendations for various exercises. So I highly recommend that book. And if listeners are interested more in kind of neck in relation to concussion, I could definitely recommend the work of John Letty at the University of Buffalo, and a couple of interesting researchers that are doing kind of emerging stuff with kind of connecting deficits in sensory motor control and injury risk. So Kelly Cheever and Julie Hides, these are names I would Google and look at the research they're publishing. Very, very interesting stuff.
Okay, lots of resources to people go to. Awesome. And then, Jóna, if people want to learn more about NeckCare, where they can find more information, you have a website, right?
Of course. Yeah, I recommend visiting our website at neckcare.com. Have a look there, and feel free to reach out if you're interested in more information. We're always happy to chat and demo the product.
Awesome. Before we wrap up, anything else you want to add? Anything I forgot to mention?
I think we probably could continue talking for a couple of more hours. There's so many interesting topics to discuss, but no, I think we've covered a lot of the essentials, and so otherwise we'll do a follow-up episode.
Yes. And do you have any social media that people can go to?
Yes, we're on Facebook and Instagram, NeckCare Official at Instagram, LinkedIn as well, and YouTube.
Awesome. Okay, I'll put all of that on the show notes so people can go check. Jóna, thank you so much for your time and to come here discuss the NeckCare system so we can learn more about that and how we can benefit from using the system and our patients can benefit, what's most importantly, right?
Most importantly. That's it. That's exactly it. Thank you, Mariana, so much for having me. It was a pleasure speaking with you.
Thank you. That's all for today's episode of PT Pro Talk. We hope you enjoyed this discussion. Be sure to follow us wherever you listen to podcasts so you'll be notified when we release future episodes. You can also join our email list at ptprotalk.com to receive updates and access new episodes. If you have ever gotten value from the show, please take a moment to leave us a 5-star review. It always makes my day and it really, really helps us out. If you have any guests or topics you'd like to see on the show, let us know by answering a quick survey. You can find the link in the show notes along with more information about our guests, resources, website, and social media. Thanks again for listening, and until next time.